Bonjour tout le monde. Hello, everyone. Welcome to today's online event featuring an excellent panel who will discuss navigating the 2021 Afghan refugee crisis, learning from the past to prepare for the future. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. As well, some of our panelists are in Calgary, and Calgary is located in the traditional territories of the Niitsitapi Blackfoot Confederacy and the people of the Treaty 7 region in southern Alberta, which includes the Siksika, the Piikani, the Kainai, the Tsuut'ina, and the Liare Nakota. They are situated on the land where the Bow River meets the Elbow River, and the traditional Blackfoot name of this place is Mokinsis, which we now call the city of Calgary. The city of Calgary is also home to the Métis Nation of Alberta, Region 3. We honor them in this land. Their cultures and presence have nurtured and continue to nurture this land. We also honor all other First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land as well. My name is Andrew Tomeyer. I go by the pronouns he, him, and I'm the Education Coordinator with N4. I will be hosting and moderating today's panel discussion. My co-host is Maryam, who will be monitoring our Q&A box today. I'm pleased to introduce you to today's panel. Amal Mahmoud is the case manager in the Department of Client Support Services at the London Cross-Cultural Learner Centre. She arrived with her family to Canada 7 years ago as a Syrian refugee and got her citizenship 2 years ago. Today, she helps DARS as their case manager, where she navigates the health system on their behalf, ensuring their well-being. She's also a recent graduate of the St. Paul University N4 online program in newcomer navigation, gaining knowledge to better help refugees and newcomers. Both her work and recent studies help her grow and prosper professionally and personally and aid her in helping refugees to the best of her abilities. Kelly Ernst is the Vice President of Vulnerable Populations at the Center for Newcomers in Calgary, Alberta. He has a PhD in educational psychology. Kelly has created numerous projects at the Center for Newcomers. In his spare time, he's co-founder and president of the End of the Rainbow Foundation. He was also a co-founder of a number of not-for-profit organizations. He's a winner of the 2020 Stars of Alberta Volunteer Award for his lifelong volunteering. And as a human rights and civil liberties advocate, he was a recipient of the Alberta Civil Liberties Human Rights Award for his work on Alberta's Bill 10 as chairperson for the public consultation of gay-straight alliances in Alberta schools. He sits on committees nationally and locally advocating for vulnerable people. Maryam Baiza Kassam was born in Kabul, Afghanistan, where she completed her grade 12 at Lycée Malalai and joined the School of Law and Political Science at Kabul University in Afghanistan. In 2002, Maryam was rewarded with a 3-year full scholarship from the UK, where she completed a 2-year postgraduate program in Islamic Studies and Humanities and obtained her master's degree in international law, focusing on human rights law from the University of Edinburgh. Ms. Baiza has also been actively involved in various voluntary positions across the Ismaili Council for Canada to empower women. For 6 years, she served as the chairperson for the Women's Portfolio, and then she was appointed as the main editor and translator for the materials concerning law and family issues from English into Dari Farsi language for the Conciliation and Arbitration Board of Afghanistan. For the last 14 years, she has been working with immigrants and refugees in Calgary as an education coordinator, and now as a cultural community outreach associate at the Center for Newcomers, engaging in community development and promoting newcomer settlement and integration issues. Julia Bietz is a primary care manager at the Mosaic Refugee Health Clinic in Calgary. With a background in both public health and global health, as well as political science, she found her calling in the realm where both worlds collide, refugee health. As well, along with Amal, we also have the manager of communications at the London Cross Cultural Learner Centre, Maria Franco, on the line as well, for any questions that may not be able to be answered by Amal. So welcome everybody. Thank you for joining our panel today, and welcome. Yeah. Today's session is being recorded and will be uploaded to our N4 platform. We'll share this with you as soon as it becomes available. Should there be any technical issues during this webinar, we'll inform you with details for an alternate makeup session. As well, before we begin today's event, we'd like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same question or be interested in a particular response. Today, you have the option of upvoting your question. Please upvote questions you're interested in hearing the answer to, and we'll prioritize which questions we pose to the panelists first. And if you have a question for a specific panelist, please make sure to include it in the question. So our speakers today have no conflicts of interest to declare. So with that said, let's jump into the questions. We have 2 initial questions today, and then we will open it up to Q&A from the audience. Please add your questions to the Q&A box. And then with the last few minutes as we go, we'll wrap up with one final question. So to begin with our first question to our panelists, what did you learn from supporting Syrian refugees in 2015 and 2016 that you are using to prepare and plan for the Afghan refugees you are or will be seeing? Let's start with Center for Newcomers, Maryam and Kelly.
Thank you very much, Andrew. I guess one of the primary things that we learned from the Syrian response is refugee wave such as this is not a short-term thing. So all of the evaluation and research about that response suggests that even 2 years down the road, Syrians were still trying to access settlement provider organizations to get the services that they need, and not just one type of service, but a whole variety of different services. Even now, our center is in the process of accepting Syrian refugees, privately sponsored refugees, that are waiting in Lebanon, still trying to get to Canada 5 years after leaving Syria. So I think one of the really key things that we're taking away from this at our Center for Newcomers is that we're trying to ramp up to provide long-term services and not simply think about, immediate, what is it that people need right now, but also what are they going to need 1 year, 2 years, 5 years from now. And I also understand that the wave of people coming, they're going to be coming in different ways. So we have the government assisted refugees, the GARs certainly coming now, but we have privately sponsored people. We have people coming as refugee claimants applying in Canada itself, and even people walking over the border from the United States. So we have to consider all of those variables when we're trying to put a current program together. And so this is why our focus is not so much on the immediate arrivals, because those people are being well looked after, but it's more what do we do once they arrive in Canada and they need to stay here for a long term, and as other arrivals come, then what are the services that we have to put together? So those are the really big things that we're looking at now. Maryam, you probably want to comment on some of the more functional on the ground things as well.
Thank you, Kelly. One of the key lessons that have been learned from serving the Syrian refugees in the past, and that are extended to serving the current Afghan refugees, is that staff should ideally be familiar with the culture, language, and customs of Afghanistan. Therefore, many immigrant serving organizations in Calgary are trying to hire new staff who speak the official languages spoken by the people of Afghanistan, which are Dari and Pashto. And at the Center for Newcomers, we also provide free training to other organizations in the general public via Microsoft Teams about the people and culture of Afghanistan, including the geography, language, religion, religious and cultural sensitivities, the education system in Afghanistan, Afghan family, customs, hospitality, music, poetry, literature, women's roles in the public and politics, national holidays in Afghanistan, forms and norms of communication and socializations, especially mixing between genders, eye contact and dining etiquettes, Attendance to these presentations is free. So far, we have delivered more than 11 presentations. And the idea behind this workshop is to familiarize those who are keen to support and assist newcomers from Afghanistan. We believe in developing an understanding of these social, cultural, and religious nuances is important for helping the newcomers to successfully settle in Canada and make our country their new home and homeland.
Thank you, Maryam and Kelly. I'll pass the question over to Julia.
Fabulous, thank you. And so I come, I suppose, from a slightly different perspective from that, the healthcare perspective. And, as Kelly speaks about the long term, we are very much the immediate needs of the arrivals. We see the arrivals for up to 2 years. So for us, for our organization, some of the really important lessons learned and the key pieces to this is the intersectoral collaboration that is just essential to this resettlement. Again, even something like this, right, where you have myself from health, you have resettlement, etc. Having all of those groups come together with the Syrians, we had education, we had law enforcement, resettlement, the gamut of providers who would be seeing these arrivals, because it isn't limited to just ourselves or just the Center for Newcomers or whatnot. The kids will be going to school, they will be interacting throughout the system. So making sure that everybody is coming to the table, everybody is discussing the challenges, opportunities, figuring out ways to collaborate together, how to overcome some of those barriers, also making sure that everyone is aware of the services available. That's something we constantly come across, even though we often sit at the same tables and things. It's never possible to be fully aware of everybody's services and resources that we can link folks into. So that's a really key piece, and one that's been really, I would say, strong already with this response. There's many tables with many players that are coming together to discuss the plans and anticipating the needs of the arrivals, both for the short term and for that longer term. And then we found that a really key piece as well was the importance of having a cultural community in the places that we were, that arrivals were being resettled. We found that was a huge asset with the Syrian arrivals, that there was already a really large Syrian community here. So that is a huge support to the arrivals. Again, from the health perspective, we had community physicians who spoke the language, who were familiar with the culture, some of those nuances that Maryam is speaking about, that was already their lived world, right? So they were ready and willing and able, and throughout the community, those supports were there to help folks navigate their new community. And then I guess just again, from a very narrow health perspective, for me, when I saw this question, and in the middle of a global pandemic, a key thing that stuck out to me is that importance of infection prevention and control. And when the Syrians arrived, and the same with the Afghans, right? They come and they're in, there's often in kind of congregate living situations where there's lots of people together. The importance of having that front of mind. And of course, we are all very hyper vigilant at this time, but that was a large issue, and just making sure we have plans and processes in place for whatever might arise. We have folks coming over, and the last thing we want to do is to cause health issues for them. So making sure we're fully prepared for that. And I'll say it's been nice thus far in Calgary, at least the flow has been a little bit slower. So we've been able to have, better spacing, better isolation, all of those pieces. So that's worked out well thus far.
Excellent. Thank you for that response. And sounds very, very a lot of coordination and a lot of working with this pandemic too at the same time. So it's very interesting to hear. I will pass the question over to Amal, and along with your professional experience to prepare for this, is there any elements, say, with your personal experience as well?
Thank you, Andrew. So I want to explain, when Syrian arrived, we tried to be prepared as much as we could at that time. However, it was very huge influx. all community came together, service provider offered help. We built a strong partnership with the community, with service provider to offer better service for the client. So we have more connection, I would say. I would give an example. We had an amazing partnership between Cross-Cultural Learner Center and Inter-Community Health Center to meet the health need for our client through the Refugee Health Clinic. The clinic was established before the Syrian influx, but it took its final shape during the Syrian influx. We have those wonderful doctors, nurses to address the need for our client. In addition to that, we have a liaison person from our department to make sure that the clinic is running smoothly. Our department, Client Support Services, CSS, we, the case manager, work with the client. We look after their health and well-being and navigate the health system on their behalf. We work with the client for 1 year. When they first arrive to hotels, we introduce ourselves, we do orientation. Then we work with them after while they are under the care of the Resettlement Assistance Program, the RAP team. The RAP team work with our client while they are still in the hotel. So for example, they do provide mandatory orientation around the life in Canada. They apply for health card, social insurance number. If there is any urgent health need, it will be under the RAP team. And of course, they will find houses for the client. When the client move to their houses, we step in and we look after them, as I mentioned before, for 1 year. Depends on some high needs for the family. Some families might have high needs, so we can keep them up to 2 years. And collaboration is very important across the department of CCLC, the Cross-Cultural Learner Center. So with the Syrian influx, and because it was huge, the CSS case manager stepped in from first day for the Syrian. When they arrived, we met them in the hotel from the first day, assessed their health need, referred them immediately to our refugee health clinic, where they were looking after their health need, referred them to specialists, prescription, any necessary follow-up. And with the Afghan influx, we applied the same approach. We stepped in to help our colleague from the first day. We are meeting our client in the hotel when they first arrive. Of course, with taking all the necessary measures because of COVID-19. Another thing, we know that when you are working, we work with a refugee, so there is always a trauma, mental health, and we know sometimes how hard to, or let's say time lengthy to access the mental health service. So to address that issue, CSS hired our CSS well-being counselor to meet the well-being issues for our client immediately. With the Afghan influx, CCLC hired another well-being counselor. I feel in general that with the experience, we learned how to manage our resource in a better way. So we are hiring more staff who speak the language class, the client's language. And we are having more training around the trauma, self-care, and the culture aspects, and even like cultural, social, even political aspects for our newcomers' arrival. That's it. Thank you.
Well, thank you. No, that was excellent. And so it sounds like there's a lot of coordination and collaboration that really helps drive a good, effective response to these crises. So let's move to the second question with respect to promising practices. What differences or challenges have you seen thus far when supporting Afghan refugees over the past over the course of 2021 into 2022? And we'll start with Julia.
Sure, thank you. So one huge asset or piece that has made it far easier, I suppose, is both the language capacity of these arrivals thus far, as well as their health literacy. I mean, obviously, as we know, those who've come over for the most part have, at least one family member who is working with Western nations or different organizations. So you usually have at least one person who is fluent in English, oftentimes multiple people, and that just makes the provision of services that much easier. You have a built-in translator in the families. Obviously in health, we still rely on interpreters for various appointments. And then the health literacy, people, they're coming from higher socioeconomic backgrounds that we've seen thus far. And so they know about their medications, they know about their health conditions, they know about past treatments, surgeries, vaccinations, whatever it might be. So when we go in, and like Amal is talking about, like you're in there right away with them, but you're able to get that picture much more quickly than with our usual patients, are the ones that we're often seeing, and that makes it that much easier to provide that care immediately. They know how their diabetes has been managed in the past, so it's much simpler to get them the care they need that much more quickly. And of course, many of them themselves are doctors, are pharmacists, are dentists, all of that. So from the health perspective, I don't want to say they're easier patients, but it's a simpler process to get them to where we need them to be. And then, as opposed to when the Syrians came, again, from what we've seen thus far, and in Calgary, we have a bit of a smaller picture, I would say, than Toronto, perhaps. Folks have been in a third country for a period of time, and they've often received care, or it's been rather stable for them. We've got folks coming up from the United States, etc. So versus the Syrians, where they would come off the plane and there would often be really kind of emergent health conditions. We're not seeing that in the same way. There's of course exceptions to every rule, but folks are more stable, and so we're able to proceed in a more methodical way than kind of having to provide that emergency care. And then in terms of challenges, and I'm sure people across the country, across the spectrum would say, one of the big challenges is of course the uncertainty around the expected arrival dates and how to plan around that, and staff and make sure it's a bit of a hurry up and wait. But that's very much outside of anyone's control. So it's just something we have to adapt to and just continue to be ready for to come.
All right, thank you for that. It sounds like there has been a lot of good lessons learned from the previous to help with this current Afghan refugee crisis. I will pass the question over to Amal.
So I just want to mention, I will start with the challenge and similarity at the beginning, then I'll move to the differences. In both Syrian and Afghan refugee influx, we are experiencing shortage of family physician and long waiting time to see a specialist. And with the pandemic, it's even harder and longer. I want to explain something about the Syrian health system and Afghan health system is way easier than the one in Canada and so easy to navigate. You don't need a referral to see a physician or a specialist, so you can access that service immediately. So our client are very frustrated, and it's hard for them to know why it's so hard to navigate the health system in Canada. And their frustration reflect on us as a settlement worker, because according to our client, they think that we are the one who are not providing the service for them, or we are not working hard enough to provide these services. They are not realizing that there is gap in the system, and any service, it will take time to access. Another thing I would say, there was a huge level of support from the community service provider when we received the Syrian influx. However, we didn't see that level of support during the Afghan influx. I can give an example. London Health Science Center deployed a team at that time to help registering the Syrian client with a family physician. In addition to that, Afghani clients arrived during pandemic, which will add more difficulties and more challenges. We know all services, including health services, shifted to virtual. So, for example, walk-in clinics are no longer walk-in clinic during the pandemic. And we used to rely a lot on walk-in clinic with the Syrian influx to refer when our refugee health clinic is overbooked because of shortage of family physician. And sometimes the situation is not that urgent, or it's not urgent enough to refer to emergency room. Nowadays, when you want to go to walk-in clinic, you have to call early morning, book an appointment over the phone. Well, I get it, it's a pandemic. I know if it's like any kind of a flu-like symptoms, we don't want the client to leave the house or apartment, just to stay home, call, receive the service over the phone. But for other health issue, why it's no longer walk-in? I mean, yes, it's pandemic, but we are still going to grocery stores in person. We go to pharmacy, even some recreational services we go on person. Other things I realized with Afghani clients, there's lots of missing documents. They don't have this document. That will lead to more delay on service. For example, because of this missing document, we cannot apply immediately for health card, social insurance number. Something I would say similarity, not only between the Syrian influx and Afghan influx, I would say with all our clients is managing high expectation for our clients, which is to be expected, honestly, different cultural background, maybe cultural shock, and the most important thing, the misleading information they might receive from overseas before they arrive to Canada. When it comes to housing, housing was an issue during the Syrian influx and is still an issue now because it's the continuous increase of the price for the rent. And, you know, it's kind of making finding house is very challenging mission. In addition to that, our clients want to be located in the same area where their extended family or community, which is very important for their social support and well-being. So our housing team try their best to meet this valid and fair, let's say, needs. In addition to that, to find housing that will fit their budget. That's still the same, did not change. And the other thing that I realized, as you mentioned, Julia, like most of our Afghani clients, at least one family member speaks English, because we know they are families of interpreter or who work with the Canadian government. The majority of the Syrian, they do not speak English, but both they are eager to work, eager to provide for their families and contribute to Canadian society, but with or without language, you need Canadian experience. Thank you.
Thank you. Thank you for that, Amal. So there's a lot of big differences that are being seen by the sounds of it. And I'll pass the question then over to Maryam and Kelly.
Maryam, you go ahead first.
Okay. Thank you, Kelly. There are common challenges that all refugees face regarding of their origins. Their challenges in a way become our challenges too, leaving everything behind at once and beginning another life in a different country with different language, laws, cultural norms and expectations, and different system of education and healthcare require a period of adjustment. There are certain things that are in common. School-age children and adolescents will face their challenges at school, especially in terms of language and coping with a difference in quality of education. As such, They need special care and attention from their school administrators. The sudden lifestyle change for these refugees is quite shocking. For example, the head of the family usually worked full-time, often outside the homes in Afghanistan. Now the head of the family is often unemployed and staying at home. In terms of children's lifestyle in Afghanistan, children often play outside at home without any supervision from adults. Now they have to be inside the home, especially when it's very cold in Calgary. Or there should be some adult supervision when they play outside. Parents struggle to take care of 4 to 5 children in a small apartment in Calgary. This is the average number of children in an Afghan family, but we have seen families who have up to 10 children. A large number of these refugees will be suffering from the psychological issues and other mental health issues. For example, one gentleman who used to work at the Canadian Embassy in Kabul told me that 70% of his own family, including brothers and sisters, are still in Afghanistan. And since his arrival in Canada, he cannot sleep properly. At midnight, he wakes up thinking about the remaining of his family back home and what will happen if the Taliban find out about them. Families who live in a village, who used to live in the villages in Afghanistan, had constant interaction with their relatives and neighbors. In Canada, they are now completely isolated, and they realize that they are thousands of kilometers far from their relatives. These people have never left their small villages, either in Jalalabad, Kunar, or Kandahar, and now the distance between their relatives and their place of residency in Canada is almost 10,000 kilometers. This is quite shocking and depressing for them. We would like our newcomers to feel settled. For us, to feel settled means to feel secure and in peace. Naturally, it takes time that the newcomers to feel settled, secure, and at peace. Kelly, would you like to add something?
Thank you, Maryam. Yeah, I don't know how much more I can really add. Everyone's been so comprehensive. I guess one of the things I would underline is the really importance of working together in a community. So it really is a community response. I think that's something that was learned from the Syrian refugee wave, and now in the Afghan wave, we're learning that yet again. So the success that I think the RAP organizations have had, and then afterwards, when people settle within the community,
Apologies, I think we just got Kelly
and
turned off there.
So we really do need to engage the larger community. What needs to really be underlined, the families, Maryam is correct, what we're seeing are very large families. And so having people that are identified as possible almost sponsors to that family are extremely important. So it's not necessarily the professionals that are doing some of the really heavy lifting, but it's the volunteers, it's the Afghan community, as Amal noted, it's really, and Julia noted, it's really important in the last wave that the Syrian communities were involved in people's lives, and that is no different than in this case as well. It may have seemed in this case as well, because this full effort was put together so quickly after a really emergent scenario, that things were developed on the fly. And I would suggest that that probably did occur, but there was no way else to do it. And so I think what we're seeing now is some of that settling occurring. And so at least here in Calgary, organizations have found their role into how to best provide that support. And so I think there needs to be some time for organizations to provide that settling and to work with the rest of their community to know where that role really can be best placed. So kudos to organizations like Mosaic that have really stepped up to the plate right from the very beginning. Because you know, when we get organizations like that stepping up so quickly and so comprehensively, it makes the effort much easier. So, you know, don't step away, step in, and provide long-term support, I guess, would be my underlying theme. So.
Thank you, Kelly. And you came right back, so that's all right with the connection. Thank you. And thank you for that response. That was very excellent. And so with that, let's jump into some of the Q&A questions that we've received from the audience as well. The first couple questions is related to the Center for Newcomers workshops. Questions being, are the workshops available to anyone across Canada? And how does one register for cultural orientation workshops?
Yes, the workshops is available for anyone. I'm going also to write my own email and Dr. Kelly's email here. And anyone who is interested, we can provide this workshop. It's for 2 hours. It's free of cost. Until now, we had 11 presentations and more than 300 people across Canada, some from USA and some even from Switzerland, logged in to these workshops. It's totally free and anybody is welcome to come.
Thank you, Maryam. And we can gladly add them to the N4 events calendar as well to share with our N4 members too. The next question is to Julia, related to coordination. Could you tell us a bit more about how coordination among organizations can be achieved within healthcare?
Yeah, absolutely. So I think it's just the information sharing, right? And as I mentioned, you know, as soon as we had word about this, and again, building on, you know, the Syrian arrivals, the Yazidi, a lot of those tables had already come together, right? So that's a huge benefit, that it's easy to get those groups back together. So just start reaching out, sitting down together, talking about what's coming, right? There's often not a lot of information, you know, as Kelly alluded to, there's always going to be an element of make it up as you go, right? No matter what happens in these situations. So get everybody together, ensure everybody is aware. Oftentimes, you know, folks don't know, we assume people know, right? But it's so important, and throughout the health system, you know, we have different departments at the hospitals coming forward and saying, what's going on? We're seeing, you know, all of these patients coming forward, and it's kind of like, oh, you realize, right, that, oh, to us, we live, sleep, eat, and breathe it. So just ensuring everybody is aware, you know, having that information sent out so that everyone can prepare, so that their teams are aware. And again, I think just being really open about the challenges, because you'll always be surprised by what solutions are out there and what supports other folks might have. And then just ensuring that those communication channels are clear. You know, we have different groups, you know, as part of the medical exam, the immigration medical exam, right? You have to do the chest x-ray. So making sure TB services know that they're going to suddenly see a whole schwack of chest x-rays coming towards them, so that they can prepare, and they're aware of all of that, so that they know their roles within the response.
Thank you, Julia. Thank you for that. This one is for all the audience, all the panelists, from one of the attendees saying, I'm hearing from many people that worked during the Syrian crisis that the response was much more organized, whereas this is seems to be not the case right now with the Afghan refugees. Long-term needs are important, but how can we ensure short-term needs are actually being met, such as children receiving winter boots and jackets, for example?
Well, in the case of Calgary, it probably is different. Even in minus 41 degrees Celsius, my colleagues and myself, we delivered winter jackets, winter clothes, boots, shoes, food gift cards, food hampers at their door. So we are very, very active in Calgary. But in terms of other regions, I cannot comment. Maybe other panelists can talk about that.
Amal and Maria?
Yeah,
So I know at CCLC we have emergency fund, so we can we share that with our client too if they have, they need some winter clothes, and also we have some organization who provided some donation. I know that for sure. If there is something else, maybe Maria would be familiar as CCLC in general. If you want to add anything, Maria, to that.
Yeah, we did a general, like a call out to the community, and we got, I think, I don't remember the dollar amount, but we got a lot of money that went towards our highest priority needs, and that was able to provide some assistance to the newcomers. And as well, we partnered with other community organizations like Goodwill and Joseph's House, and also St. Leonard to get some furniture for the families as well.
Thank you. Thank you for that. That was a good response. Thank you.
I'll just add a couple more things too. Is one of the things that we've noticed is some of the people that may not be the government-assisted refugees are coming, and they're immediately, in some cases, not eligible for services. So we've had to find ways to simply ignore those eligibility requirements from various funders and saying, no, you're going to get the services regardless. We're going to find a way. So if that means using private donations to do that, then we absolutely do that. So we don't send anyone away. That is just bottom line. So we take in everybody. That's one thing that's super, super important, I think, in waves like this, because the people that are not getting the services immediately can really undermine the whole system. And so we've got to have a quality of services across the board, regardless of people's status or eligibility or those kind of issues. The other thing that we're doing at the Center for Newcomers is we have a microloan program. So people can access that to pay rent, security deposits for accommodation, for food and clothing and the things that they need. Now that's dependent on funders and donors being able to give that. But one of the things that we did in that program is absolutely ensure that the eligibility requirements, as it said, are not dependent whatsoever on the immigration status of the person that is in front of us.
Thank you. Thank you for that. We also have a question from an attendee that's in Waterloo. How are your organizations supporting school-age Afghan refugees that are living in hotels awaiting to be registered to schools? We have a challenge in Waterloo, Ontario, and from my knowledge, it appears that you require sort of that place of residence before getting into a school. So would you be able to speak on that?
So unfortunately, I know that I don't know if it's across Canada or only on Ontario. To register in a school, you need to move to your permanent house. So while they are in the school, in the hotel, the children will not go to school, but they will go after they move to their house. We have another department at CCLC. They will help the family. They register them at school. Also, we have a Swiss worker, the worker who work in the school to address any need for the children, their family. So we have different departments, but for schooling things, it will be after they move, which is not only for refugee. Any newcomer who come to Canada, you cannot go to school unless you move to your permanent house, because also it needs to be on your area. So, yeah.
Yeah, and the same, I don't want to speak for another organization, but in Calgary, there's lots of programming being offered to the children in the hotels to ensure, they're being kept busy, that they have opportunities for physical activity. You go in and you see amazing crafts things I could never imagine coming up with, like lots of different programming to keep them engaged. But it's certainly a frustration. It's certainly a huge frustration for the families. You know, that question of I want my kids to go to school. We're ready. And I think that's why there's such a prioritization of housing beyond wanting to get them out of hotels, of course, but that schooling piece is a huge aspect of that, to be sure. But definitely agree with them all. You know, a frustration across the board in Canada.
And if I may add to what you said, also consider the pandemic, so less interaction. It's different than what it was during the Syrian influx. We need to limit, it's not only us, everyone in Canada, to limit the interactions. So unfortunately, housing team trying their best. I know in London, I can tell you, like we received around 187 clients. So far, we have find houses for 167 clients. So 58 families out of 65. So they are doing great job, the housing team.
Thank you. And just with respect to Center for Newcomers, or how have you been dealing with the finding housing for Afghan refugees?
Well, at the Center for Newcomers, we have a team of 20 people who are looking after helping the Afghan refugees, not only with finding houses, but also with fair entry letters, referral to the food bank, referral to Women in Need Society, registering their children for Calgary Board of Education, registering their adults to English assessment at Immigrant Services Calgary, donating winter clothes, shoes, boots, household items, furniture, kitchen dishes and appliances, gift cards, food hampers. And also we have been providing presentations to the Afghan refugees on mental health and bringing speakers from within the Afghan community who are psychologists and neuroscience specialists.
Thank you. And I believe that answered another question related to the housing piece. So I think we only have time for one more Q&A question. So this one is from, well, Sahar. How is the pandemic adding to the challenges of providing healthcare services to Afghan refugees?
So I guess pandemic is adding challenge to everything. We know that everything has to be delayed. And we know when it's come to health, like, you know, we're all aware across Canada, let's say, for example, all surgery put on hold now, unless it's extremely emergency. And even I heard over the news, like some cancer treatment without the last 2 years, some of them might put on hold. So everything that will add up. And I can give example from London, let's say, not from the news, not from what we're hearing. I already mentioned that how much we have shortage of family physician, and meeting even a specialist has a long period of time. The pandemic adds even longer. And now if we happen to succeed to find a family physician and we submit the application during to whatever restriction we will have, lockdown, that will postpone, because the family physician will tell us, when I first, let's say, meet and greet my clients, I want to meet them in person. I want to get to know them, to know their health issue. Then later on, it's okay if I have to follow up over the phone. But at the beginning, so this is one of the examples. I hope I answered your question.
Oh yeah, thank you.
Well, sorry, Julia, go ahead.
Okay, sorry, thanks. Yes, so I mean, I suppose we're lucky at the Mosaic Refugee Health Clinic. You know, we're a very, very large clinic with family physicians and specialists and nurses, and so you know, very, very familiar with all of the precautions, and so we've just layered that in to what we're doing. Certainly having, you know, fewer face-to-face interactions. So, you know, we're there in hotels providing services, but of course, you know, as Amal speaks to, you know, trying to do as much virtually as we can. You know, of course, patients are in their 2-week quarantine upon their arrival as well, which can present challenges. You know, we don't get to see them as quickly as we would otherwise, so we're not able to address. So we're kind of providing surface level or sometimes, you know, band-aid solutions, for lack of a better term, right? Trying to just kind of keep them healthy and maintain their health while they're through that. And then we can start running further diagnostics and things like that. Again, of course, if there's a need, you know, we can move that along much more quickly. But definitely, you know, creates challenges for those who need to access hospital services. There's been challenges around prenatal patients, and ensuring, you know, that the community is aware they're in quarantine. This is what they cannot do. So just factoring that into everything, and agree with the slowdowns. And again, I think to something I think it was Amal said at the beginning, you know, it's a very different health system. You can't kind of just access providers when you need to. You have to wait, and those slowdowns exacerbate those frustrations. They know they need to see a specialist, or they've been waiting, and they have to wait that much longer for it. So all of that in the same way that it impacts everyone.
Thanks, Julia. Thank you. Did you want to add to that, Maryam?
Well, when we do need assessment amongst our Afghan refugees, which we have served so far 331 individuals or 74 families, we ask them that what languages can you speak? And that helps us. That helps our settlement practitioners to refer them to the languages and to those doctors who speak those languages. Luckily, Afghan people, they speak multi-languages. They speak Dari, they speak Farsi, which we can send them to Iranian doctors. They speak Hindi. They speak also Urdu, a lot of them. So that helps us when we do the need assessment. We ask about the languages that they speak.
Thank you. Thank you for that. And so with that, we will be moving the Q&A questions to our meeting place for our panelists here to respond to them. So let's wrap up with one final question to our panelists. If there's one thing, whether that be at the local, provincial, national, or international level, that our audience could start doing today to prepare supporting refugees, whether they're from Afghanistan or elsewhere, what would that be and why? And I'll start with Amal. Sorry.
When you work with the clients, work with them with humbleness and respect. Validate their feelings and concern. Listen to their stories. They are the expert of their life. Learn from them. Work with them as a team. Walk with them the integration journey. Integration is a process, two-way and lengthy time. I would say empower them, wrap around them, provide equitable opportunity to thrive and succeed in Canada. Thank you.
Thanks, Amal. Kelly and Maryam.
Kelly, go first.
Yeah, thank you very much. I guess one of the things and one of the risks to pay attention to is that stories of inequality create outrage in the public, and it really does undermine everybody's efforts. So that is one thing that we learned from the past, and I think we need to learn in this example as well. And what I mean by that is, when I said my comment, anyone that comes to your door, make sure they get the services that they need immediately as you can. And don't worry about their status. Don't worry about their paperwork. Don't worry about whether or not they have this piece of paper versus that one. That will come in time, but get them the services that they need to settle, whether that's English, whether that's a home, whether that's food, whether it's clothing, whether it's medicine, doesn't matter. Do what you can to get it to them. That is first and foremost one of the biggest pieces of learning that we're noting right away. So I've gone as far as been advocating at a higher level to ensure that there's public policy created from IRCC to ensure that that actually can occur regardless of status. So that, for example, those refugee claimants that traditionally have to wait 22 months, that's the waiting period now, to get their protection status, and so that they can get the services, that be waived, and that federally funded services can be used to provide services immediately. And that makes a lot of sense because in the last year, IRB's own website says all Afghans that have come to them have been approved. So why let them wait? It doesn't make any sense. So just give them the service right from the get-go, and that actually clears up a whole bunch of gaps. It clears up a lot of trauma that they may experience and be accentuated over the coming period. But as I said, I'll leave you with that. Give them what they want.
Thank you.
Thank you, Kelly. One thing that I would consider for today's audience that they can do for the Afghan refugee is that donating your time and knowledge. You can take this can take the form of tutoring children or mentoring families and making them familiar with our cities' various systems in the Canadian work environment. And as Amal said, be understanding and show compassion towards these refugee families. Remember that these families have experienced conflict, fear, poverty, trauma, instability, inequality, and racism for years. You have to meet them where they are, and you can't expect that they will meet you where you are.
Thanks, Maryam. And finally, Julia.
Thanks. And I would just say, again, start building those relationships, start building those partnerships. Are very eager to start their lives, to get going again, to find work, to be in school. So start building those opportunities, especially with these arrivals. Many have been, the hotels they arrive in here are not the first hotels they've been in. They've been in hotels in Germany. They've been in hotels in various countries around the world, waiting. So start showing that light at the end of the tunnel. Show them the opportunities that are coming, so that they know that their lives are going to start, and they're going to be able to seek out those opportunities and have success. And through those relationships and partnerships that we're going to be able to provide that support as they settle in.
Thank you, Julia. Thank you for that. And once again, thank you all our panelists for the discussion today. We've had a very excellent turnout. We've had a very excellent discussion around what has been learned from the past to prepare for this future. So I do want to thank you all again for being present and here today for our first panel discussion of 2022. So again, thank you very much to our panelists for taking the time to participate in today's discussion, and many thanks to you, our audience, for joining and engaging with us today. And you're very welcome to join us again for any of our upcoming events, including our upcoming N4 virtual online conference that is free to all, funded through the IRCC, and which will be including a couple of our panelists here today presenting as well. And thank you, yes. If you missed any part of today's presentation or would like to watch this session again, we'll be posting this recording to our N4 platform within the next week or so. We want to continue the dialogue that this panel has started, and we have many questions that were left by our audience in the Q&A, and we'll be moving all those questions that we did not get a chance to address to our online moderated discussion forum called The Meeting Place. We have invited our panelists to respond to your questions there. We've also curated several resources related to today's webinar topic, and you can find these in our resource toolkit, and we will link them when we share the on-demand version of this discussion. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and learning opportunities, and to check out what our upcoming conference is going to be about. Following today's session, you'll be invited to complete a survey to share your feedback with N4. These surveys help us continuously improve and seek out new webinar content and opportunities that are responsive to the topics that you are interested in. We kindly ask that you follow the link and complete this brief survey after this session has concluded. Thank you again for joining us, everyone. Thank you again to our panelists, and we hope that you can join us again at a future N4 event. Stay safe, stay well, and have a good day.
Thank you.